is Alexandra Jones. I'm speaking today to Dr. Jesse McKey, ophthalmic surgeon at the Whitsett Vision Group in Houston, Texas, in the USA. We will talk today about developing his innovative product idea with the help of Diametrics. Hello, Dr. McKey. Could you first tell me about your practice? What kind of patients do you usually treat?
So again, I'm an ophthalmic surgeon in Houston, Texas. We have a refractive practice, meaning we treat, mainly cataract surgery, refractive lens exchange, LASIK, and a couple other corneal procedures like corneal cross-linking. I would say our average patient is maybe between 50 and 70 years of age and, comes to us mainly interested in improving their vision. They may not know exactly what procedure or in what way they want to do it. They just want to see better, and it's up to us to use all the tools we have to help facilitate that.
And could you tell me about your innovations, your products? How did you come up with the ideas and how did they develop?
Yeah, so, over the past few years, we've started to come up with a few different ideas. I think it mainly originates either in the operating room through having a problem that doesn't have a good solution, or maybe patients asking for a certain procedure or a certain thing that doesn't readily have an answer. So, I think it starts that way for most surgeons. We have it on right now, specifically with Diametrics. One is, kind of a lower tech device that we use to remove the corneal epithelium and corneal cross-linking. If we feel that if we can do that in a way that increases healing time and lessens patient discomfort, then it's kind of a win-win situation for everybody. And there are a couple other things, but that's kind of the latest thing we've been working on with those guys.
Protecting your innovation, your idea, is really important. Could you tell me how you knew that you could trust Diametrics to protect it? These guys have been around for 15, 20 years, if not more. They have several established devices in the ophthalmic industry. And, I think, number one, their track record speaks for itself. They're well respected at all the major and minor meetings. And I think their booth is probably similar to one of the taco stands around here at lunch with a long line around it. So, certainly, I think, like a night, it always looks like a good place to go. The other thing is that we're a small community. Ophthalmic surgeons are not too great in number, that everybody kind of knows everybody else's business, for better or for worse. And, I think if there are any bad actors, it comes out pretty quickly. And, again, I think across the board, they have a good track record, and it speaks highly of what Ron Dykes has done up there and the relation have with the industry. And could you tell me in a bit more detail about how Diametrics helped you evolve your idea?
Yeah, certainly. So, again, as surgeons, I think we tend to come up with ideas either because patients are asking or because of a problem that we encounter in the OR that doesn't have a great solution. I think from that standpoint, I'll give us as surgeons generally maybe an A or A minus in innovative ideas. I think they're always there right at the forefront. But maybe a C minus in the ability to practically design something in an effective and a cost-effective way that would be something that could be produced and marketed. So, I think Diametrics really comes in there. Their expertise in different types of production methods, different types of materials is really, really second to none. We sit down and have a consultation where we talk about what our intended use is and what we want to do. And Diametrics can come back with, well, if that's the case, then maybe we should design it in this way. And I think doing that, we can get you a good and usable prototype.
And where do you intend to go with your products? Are you developing them for personal use in your OR, or would you like to bring them to market?
Well, I think
all surgeons would like to see their products used in the market. I mean, certainly there's both financial and professional benefits there, but I think anything we develop is for the betterment of the industry. I mean, it sounds cliche, but we really want to see things being used for patients and surgeons' benefits. I think again, working with a company like Diametrics, it really helps us take a sketch or an idea and turn that into a usable prototype. Just this morning, I'm going to be using yet another iteration of one of the prototypes of our device, and that was something that's hot off the presses from the guys at Diamatrix. So I'm really excited about that, and hopefully we can move things down the pipeline to a point where it would be something to be produced on a larger scale and marketed to the ophthalmic community. Yeah, that'd be great.
And finally, would you recommend Diametrics to other surgeons who might wish to develop their own product ideas, innovations?
Oh, definitely. I think our relationship with Diametrics speaks for itself. We've collaborated with those guys in at least 3 or 4 different devices. I think if we had a lukewarm relationship, we'd be going back. So we're really happy with the relationship that we've formed with the company over the years. I would certainly recommend guys up there. The only thing I'd say is you better be prepared. They get engaged and they get excited about products. So they're going to be sending sketches, emails. They're going to be sending updates, and I think if you're going to engage Diametrics, you should be prepared for that.
That's great to hear. Dr. McKey, thank you so much for talking with me today.
Well, again, it was my pleasure.